Great. Dr. Samir Khan from Srinagar. Samina Khan, Dr. Samina Khan, great. Amazing, amazing. So nice to just see so many new people. And also I see a lot of our regular doctors who take the effort and not miss any inner circle class. So I see also a lot of our regular doctors, Dr. Gaurav, Dr. Rajesh, Dr. Sundeep, Dr. Renuka Shetty, Dr. Ritesh, Dr. Rohit Menon, Dr. Kalpana, Dr. Neil. Great. So nice to see all of you. Dr. Archit, Dr. Vikas Goel, Dr. Nikhil, Dr. Ankur Dut. Great, great. Super. And also I'm still seeing a lot of people who are probably attending this for the first time. Dr. Sridit from Kerala, welcome. Good afternoon, Dr. Manu Bhaskaran. Good afternoon. Hello, nice to see you. Great. Great. Right. So I hope we are all set for today and we can start straight away with our intraoral welding. Hi, Dr. Rajkumar. So regarding intraoral welder, I want to know how many of you first are probably placing basal implants and are already aware or are doing intraoral welding. If you can just let me know if you've done, not done, if you've done, are you doing regularly, quickly in the comment box so that I know what is exactly the situation at your end. And accordingly, we can, discuss various things as far as intraoral welding is concerned. Okay, great. So many people are already aware. Anyone who is not heard about intraoral welding? Great. Okay. So, today we are going to discuss primarily what is the principle of intraoral welder, how the intraoral welder works, how to avoid any kind of sparks or, those large kind of electric shoots which happen during the intraoral welding. What is the correct position of the intraoral welding wire? What is the best thickness of the wire to be used? What are the probable indications of removing the wire or keeping the wire? So all these things we are going to discuss regarding the
macam maka udah ka.
great. Okay. So let me just put up my presentation. Are you all able to see my screen? Can you just confirm if my screen is visible to all? Great. Okay, and I'm also simultaneously watching all of your comments. So whatever your queries are there, you can drop it and we'll take it after the end of the presentation. So right now I request all of you to just focus on to go. Can you just so can you just confirm me if my sound is audible? And the way the entire presentation is, I think it will cover up all the scenarios, all the situations. And in case after the presentation, still if any queries or doubts are there, definitely we can discuss it. So I hope it is clear to all and we can start. Right? So regarding intraoral welding, first thing we need to understand is why we need to do intraoral welding. Now, all of us are aware of this fact that when we place our immediate load implants, let it be BCS or KOS, the moment we place the implants, there will be some kind of a trauma either during the osteotomy or during the placement, which has happened in the bone. And this trauma relates or results in bone remodeling. Now, can anyone tell me what is in the chat box? What is the first step of bone remodeling? Can any one of you quickly put up in the comment box? So the moment we place an implant, we drill an osteotomy, some kind of tissue injury, bone injuries happen, which stimulates bone remodeling. And the first step in bone remodeling is a osteoclastic activity, which means the bone has to dissolve. So a lot of you people, we think about bone formation or bone integration, but some of us are not aware that the first step in bone formation is actually the bone dissolving. And after that, the woven bone formation happens. And later on, the primary mineralization and then the secondary mineralization. So it's like a cycle where first bone remodels. In the first step of remodeling, the bone starts dissolving. Then there's a matrix formation and then a calcification which happens. Now, obviously, if there is any micro motion of the implant during the phase of remodeling, primarily in the osteoclastic activity. So you place your implant, and if there is, and obviously we are doing the immediate load implant. So you put your prosthesis, patient is chewing. We do not want any micro motion. Remember, micro motion more than 200 microns during the phase of healing will lead to soft bone, woven bone, cancellous bone formation, probably failure of the implant. So we don't want any kind of, bone, soft bone formation or cancellous bone formation or woven bone formation around our implants. We want our implants to be absolutely rigid during the phase of remodeling, which typically lasts up to 3 to 6 months. During that phase, if there is any micro motion, it may lead to faulty healing and ultimately failure of the implant. To prevent this micro motion of the implant during the phase of healing, we require what is called as intraoral welding or syncrystallizing, which holds our implants in a way that there is no micro motion and all the implants synchronized. They allow the force distribution without causing any micro motion more than 200 microns. This thus allowing the nice and healthy bone formation around the implants, which at a later day we can say it is osteointegrated or osteofixated. Is everyone clear that what is the purpose of intraoral welding? Can you just put clear in the comment box if you have understood what exactly is the purpose of intraoral welding? The purpose of intraoral welding being to prevent any kind of micro motion during the phase of healing so that healthy bone formation can regenerate around our implants. Micro motion more than 200 microns during the phase of healing will cause lack of osteointegration or probably failure or woven bone formation or callus bone formation around our implants. Great. So I hope it's clear so far to all of you. Now let's understand how exactly the intraoral welder works. So basically this device, it contains a capacitor which stores the voltage from your main supply inside it. Okay, so you got a capacitor which stores from your voltage line the voltage in a low voltage source. So it creates an ultra low voltage inside it, and the capacitor stores this energy or the voltage. Once you press the foot pedal, step 2, what happens is the entire circuit gets completed, which means that you put the pliers on the patient, the abutment is there, the wire is there, and a large amount of thermionic emission happens. What happens is the current, it works on Joule's principle, which has a very high resistance and it flows in a very less time, which causes a thermionic exchange, which means what happens is this thermal ramp or this heat generation is so high, rising almost up till 1700 degrees Celsius, causing the metal to kind of reach its melting point, but not the melting point. So we know the exact melting point of titanium. So this voltage ramp causes a thermionic exchange wherein the surfaces of the titanium which are in contact with each other, they kind of dissolve and immediately fuse, because mind you, this voltage ramp or this power is only for 0.2 to 0.3 seconds. So immediately the cooling effect happens, because what happens, the moment you have pressed your probe, there is a current discharge. The current causes the thermionic exchange, causing them to fuse. However, because the probe is designed in a way that the remaining part of the probe will allow the heat dissipation, there is no tissue injury, and whatever parts were in contact with each other, they kind of fuse with each other. The other important thing to note over here is that in the cooling stage, a continuous pressure of the probe needs to remain. So what happens is, lot of times we put a lot of emphasis on the heat or the current passing, but all of us, we forget that the moment the fusion has to happen properly, what needs to happen is that the areas which are close to each other, they need to melt. And when they are fusing, the plier has to have a constant pressure on these fusing points to create a good bond called as crystallization. And this is one of the reasons your plier design plays a very important role. Not only it should be convenient to use, but in some way it should have a good pressure grip, a force when the fusion is happening. So let me read out the slides for you one more time so that you understand this. Number one, the main voltage gets stored as an ultra low voltage stored in a capacitor. Is this clear so far? Number two, once you press the full pedal, the capacitor charge will flow from the pliers into your titanium elements, which are the welding wire and the abutments. Once this current is flowing, the temperature will rise so high in the contact area that this causes some kind of melting or fusion between the contact points of the wire and the titanium abutment. This speed of the thermal ramp is so fast that heat exchange outside the welded point is limited. What it means is that this welding points, the heat is limited to those welding points. The heat does not dissipate outside. So how to understand this is, let's say you have a container of boiling water. If I go and put my hand on it, obviously I'm going to get burned. But if I'm just going to like 0.2 seconds go and touch it, you will not have any injury or any kind of a burn which is happening. And this is one of the reasons that when you are clamping, the probe designed by Trisha Enterprise welder in such a way that the heat will not get dissipated. And even if it gets dissipated, you're not worried, because the entire ion exchange has been facilitated in just 0.2 that of a second. Apart from it, the pressure applied by the pliers allows the parts to get welded together, and this process is called syncrystallization. The micro time combined with the calculated pressure allows the fusion of the titanium rods. I hope every one of you has understood how the Joule's principle works, what is the capacitor, how the heat flow happens, why there won't be any thermal injury, why there won't be any skin burns, why exactly the pliers should be hard enough to create a good compression during the cooling phase. Is this clear to all? Please let me know, right? So please let me know in the comment box. You can put up clear in the comment box and we can proceed. Were you aware of all these small points which we are discussing today? So though many of you have done the intraoral welding, were you able to understand and were you aware of these points, these small in-depth points about the intraoral welder, especially those who have already used it? Okay, so this we have already covered. I will just repeat it, that why the Trisa welder will never cause any tissue injury, because a lot of people are worried that when the welder goes in the mouth and you're like pressing the foot control, temperature is rising till 1700 degrees. Why won't the heat generation injure the skin? The reason we already discussed, one is that titanium is a poor conductor of heat, so it does not allow the heat to pass from the contact point outwards. Number two, the probe is designed in a way that the thermal conduction happens very fast, which means the heat gets dissipated very fast. Number three is that we are also using the air and coolant spray along with our intraoral welding, which further enhances the cooling effect. And number four is that this entire exchange happens in less than 0.2 of a second. The contact time is too less to create any kind of thermal injury. How many of you are getting many bulb on movements right now? Weren't aware of this? Just let me know. Yes, Dr. Chaitra, any kind of queries or anything, we will discuss it after the webinar. Right now, you just focus on what are the in-depth points regarding the intraoral welder. Okay. Now, lot of doctors are also worried that what is the right way, because some doctor will mention that, my patient got a shock-like sensation, or there is a huge spark when I'm doing. Most of the times, as I mentioned, the design of the probe, the weight of the probe, the biomechanics of the probe, along with that, your contact between your abutment and the wire, the way you have held them makes a very big difference. If there is any kind of micro space between your probe and the wire, what will happen is the current passes through air and that causes some kind of a spark. So now let me demonstrate to you with the help of these videos which are shared with us by one of our doctors, Dr. Nihal. He's used the Trisa welder, very fond of it, and he shared these videos for all of us so that we can understand how exactly the wire, when they are not fused nicely with the abutment, the current passes through air. So what he's done is he's kept purposely a small space between the wires while doing the welding. So just have a look at the video. Now this video demonstrates, right now if you see the video, you can see clearly that there is a small space between the wire and the probe. So the wire is not nicely adapted to each other. So if you're welding two joints of a wire, the wire need to be closed. But if there's a space, and now if I try to weld, there will be a spark, which you can see now. Okay. So as you see here, there is a small space. Okay. Got it. And now, just let me replay it for those of you who haven't see this. There's a small space between the wires and you can clearly see the spark. Let me just replay it. Okay, just let me know when you guys are ready. I'm replaying it. And you can see the spark happening because the wires are not adapted properly. Can you see the space between the wires? Yeah. And could you see the spark? Just one last quick view before we move ahead. Just see the spark again. This is when the current is passing through the air, causing the spark. This is nothing to do with the welder. It is to do with the technique of way you are using the welder. And next, when you see the wires are adapted nicely, now you see in the second video here, which I'm playing, that the wires are adapted very nicely. Can you see the wires are adapted very nicely, very close with each other? And now you will see that there is absolutely no spark. That's it, done. I'm just replaying the video. See this. Concentrate on the probe, no spark. Just concentrate on the probe one more time. No spark. Okay. In fact, in our live demo sessions, I even hold the wire and we clamp and we start the machine and you will not find any current on your fingers also. So a lot of doctors, this is one of the exercises we do to remove the fear from the doctor's mind, where we are holding the wire at the other end, and at this end we are welding, and you will not see any current, nor you will see any sparks affecting you. Okay, so I hope all of you have understood the primary reason of why the sparks happen and how to avoid them. Now let us discuss the indications of the intraoral welding. Is any one of you aware of what could be the possible indications? Especially those who have read the textbook, they will know. Can you quickly type in the comment box? As per you, what are the indications of intraoral welding? Okay, great. So many answers I'm seeing. One of the primary indication of intraoral welding being temporization, which means that when you placed your implants after the extraction and you're expecting lot of tissue shrinkage, obviously you don't want to make your final permanent prosthesis directly at that time by making an impression. So at this stage, if I use an intraoral welder, splint the wire, I can place the acrylic prosthesis instead of my ceramic or other prosthesis, and the wire will act like a splint. This prosthesis, later on, you can cut it out after 3 months, 6 months, whatever time of healing is needed, and then make a new impression for your permanent prosthesis. So this is one indication of the intraoral welder. More indications of intraoral welder. Let's say, especially as a beginner, you have placed the implants and you are not 100% sure about your placement or your torque. Let's say you place 10 implants, 1 or 2 implants are, not in good torque, but you are in a helpless situation. You want to keep them. In those particular situation also, when you do an intraoral welding, temporization, it allows you to re-examine your implants after 3 or 6 months. But if you directly put your permanent prosthesis and God forbid one of the implant gives you problem, you're stuck up. So the second indication of intraoral welding is also when you haven't probably got a very nice torque or sufficient number of implants, maybe due to infection, your abilities, whatever be the case. The third indication of intraoral welding is when you're not sure about the patient's bite. So let's say these patients who come to us for full mouth cases, you're not 100% sure whether it's giving a proper centric or a cross bite situation. Now imagine what will happen if you record that bite, make a permanent prosthesis, and you realize that you've completely gone wrong with the occlusion. There is no way you can later on keep modifying or altering your prosthesis, your ceramic prosthesis, which is now in a permanent cement. However, if you've taken this intraoral welder, welded the implants, placed in acrylic prosthesis, then you may keep altering your prosthesis or keep modifying or even keep making new prosthesis till you are 100% satisfied about your bite. How many of you knew this other indications of intraoral welder which I just mentioned? Just type me in the comment box. If it was new to you, just type new in the comment box. Right? The purpose of this meeting is to have interaction so that you get the in-depth knowledge. So I request doctors, whoever is listening to me, just pay attention, be vigilant enough, try to give the responses that will help you understand this science better, and it will register a lot of points in your mind. Great. Do you all agree that this could be the other indications of an intraoral welder which we have never thought about? Something very new. Now let us also discuss in which situations you should not use an intraoral welder. The only one absolute contraindication for using an intraoral welder is a patient on a pacemaker. So if the patient has a pacemaker, there is a possibility that the rhythm of the pacemaker get altered because of the circuit you're creating with the intraoral welder. And for this reason, you should never ever use intraoral welder in a patient with a pacemaker. The other risk is not a contraindication, but the risk with a welder is you should never use it in any area which is like having some kind of a material which can catch fire. So for example, some doctors, they have a spirit bottle lying close in the operatory, or if you're working in an operation theater where there is a oxygen line. So these areas you should be very careful that you don't have any inflammable items over there. And if that is the case, you should be extra cautious not to create any kind of a spark which may lead to a fire kind of a situation. So I hope you understood the absolute and the relative contraindication with the intraoral welder. Regarding stents, Dr. Shrikant is asking, you can absolutely use, there is no issue at all. Okay. The only contraindication is the patient should not have a pacemaker. And I told you the reason, because the pacemaker is actually setting, it runs on a battery which actually sets a rhythm for the heart. It is given for arrhythmia for patients who have arrhythmia. So this pacemaker actually sets the rhythm for a heart, and then if you create another new circuit with the patient involved, it may interfere in that rhythm. And that is why the apex locator and the intraoral welder are contraindicated for patients who are on a pacemaker. Now, another common mistake I have seen in a lot of WhatsApp groups, people are discussing that why can't we just pick up any cheap titanium wire? So there are a lot of cheap titanium wires available on Amazon and other websites. And just to save 200-300 rupees, I've seen a WhatsApp discussion where doctors are trying to use cheap quality wires just to save 200-300 rupees, buy from Amazon and use it. Now, what is the problem on using, though this may be titanium? Number one is the compatibility of the titanium to titanium is very important for efficient bonding of your implant abutment and the wire. If this compatibility is missing, in a way you're compromising on the bond strength, and in a way, if the splinting effect is lost, you're compromising on your implants. The second problem is that because these wires are so loose, there's a lot of impurities. We all know that titanium has an ability or is prone to form titanium oxide, which in simple language, there's a lot of impurities on these wires. And that is when you try and use a cheap quality wire with your titanium, you may see that the quality of bonding suffers. So please don't try to save 200-300 rupees. The welding wires which we supply are absolutely compatible with the implant, almost of the same metallic configuration. Also, you will see a good malleability, which is a good property of the original titanium wires. So please do not use this cheap, freely available titanium wires from the internet. Otherwise, you may end up doing a good procedure, but just by trying to save this 200-300 rupees, you may land up with a problem, especially if this wire debonds. So technically, when you're doing it, you will feel everything is right. But because the bond strength is affected, when the patient starts chewing, ultimately the wire will debond and your case will suffer. So this is one of the reasons you should buy only the standardized titanium wires, which are available in 1 millimeter, 1.5 and 2 millimeter. The simplest way of knowing which wire to use when is this. So just note it down. For any kind of segment cases, which means 2 or 3 implants, the wire which you should be using is a 2 millimeter wire. For every other case, you need to use a 1.5 millimeter wire. And if you need additional reinforcement, which means if you want 2 wires, then the second wire will be a 1 millimeter wire. I'll repeat this. For a segment case, you should be using a 2 millimeter wire. So if you're doing a segment, let's say 3, 4, 5, 6 or 1, 2, 3, something like that. If you're doing a segment case or you're putting 2 implants for a single molar, you need to place a 2 millimeter wire and splint it. However, if you're doing a full arch case, then the wire of choice will be 1.5 mm, And if you need additional reinforcement, then you need a 1 millimeter wire above your 1.5 mm wire for additional reinforcement. Is this clear to all? Please just let me know clear in the comment box. I hope all of you are with me so far. Are you all enjoying and getting the minutest of knowledge tips regarding the intraoral welding? So far we discussed what is the principle of intraoral welder, how it works, what should be the configuration and the exact correct intraoral welder you should be selecting, what are the properties of a good intraoral welder, what should be the property of a good quality titanium wire, and what should be the dimensions of the titanium wire in particular situations. Also, we studied the correct technique of intraoral welding and why it will not burn any skin tissues and how you can avoid a spark in your operatory while you're doing the intraoral welding. So far, what were your new points? If you can just put up in the comment box. One new point, if you can, whichever group you are in, I request you to just, if you're an inner circle member, you can use the inner circle group 1, which we are opening up right now. If you're inner circle group 2 member, you can put it up, one new point you've learned so far. If you're a premium group member, you can put up it in the premium group. So just let me know what is the one new point you have caught so far which you are not aware of. For those of you, before I show you the live demonstration, the recorded live demonstration of how exactly to weld, for those of you who are new to this community or are not aware, I will quickly show you the roadmap of how exactly you can go about deeper into this science. Okay, so just let me, how many of you are aware of the roadmap of how to start studying into basal implants? Just let me know me. Those of you who want it, just put up want it in the comment box so we can decide, whether we can have a quick summarization of how exactly you can go deeper into this science. So I hope all of you are able to visualize my screen where I'm giving you the roadmap of how exactly you can take it up step by step, sequentially, methodically to learn this science. So number one will be the ways of getting the deep knowledge totally free of cost, which you can get over our WhatsApp group. So we have the inner circle WhatsApp group, which anyone can join. It's totally free. And you can start getting the knowledge related to the immediate load implants, surgical as well as the prosthetic part. The other thing you can do is search for my YouTube channel, the link of which my team member is placing right now in our comment box. So this YouTube channel has close to 400 plus videos and which get added over a period of time, wherein you can start seeing various surgeries, which include the nerve bypass, pterygoid, nasal cortical engagements, prosthetic steps in them, how to take the jaw relation, what is the kind of prosthetics to use, various tips and tricks discussed in depth, totally free of cost. So I see a lot of you people have still missed probably subscribing to my YouTube channel, which I strongly recommend you can, so that you get a notification whenever we upload a new video and you can watch it on YouTube. So the link of the YouTube channel we have already put up in the comment box. You can just click on the link, and if you're interested, you can become a YouTube subscriber, wherein you can start watching these videos and also get notification anytime a new video is put up. For those of you who are still wanting the in-depth knowledge, but not wanting to go wholeheartedly 100% in with the investment part, you can invest in the textbook. So we have two textbooks, the surgical as well as the prosthetic textbook, which cost around 4,500 per book. So just by investing less than 10,000 rupees, you can have a complete knowledge about the surgical as well as the prosthetic part of immediate load implants given to you in a very sequential step-by-step format. For those of you who read the book, I'm sure you can put up in the comment box how useful it was for you. So this is for the beginners, the textbook. Along with that, you can supplement it with the HD video library, wherein you will see a lot of pre-recorded surgeries explaining you step by step, where I am talking loud, thinking loud, and while doing the surgery, I'm explaining you each step in detail. For those of you who want to assimilate all this information and also remain in touch with a larger community who is continuously interested in this kind of situations, discussing day in, day out, the various situations, discussing their cases, discussing mistakes, discussing tips and tricks, you can join our premium inner circle group, which is less than 1,000 rupees for joining. And along with joining, you get a series of webinars which are pre-recorded, which discuss various situations like pterygoid implants, case planning, how to 5x your implant practice, etc., etc. So there are these entire webinars which my team members are putting in our chat box. You can just go through the list, and if you're interested, you can join the premium inner circle group and get the complete webinars. Along with it, you can get a direct access to the WhatsApp group and all our R-Line mentors who are there to help you 24/7 whenever you are putting up your doubts or anyone else's with the discussion. Also, you can learn. So this is, I think, the first part of it. Now, those of you who are interested in going deeper into this subject, you can attend or start with attending our 3-day program, which also not only gives you access to various lectures, theory, hands-on on the dummy jaws, you watching me live surgery, but you can also place implants under my guidance and also do the prosthetic work of these patients under the guidance. So the next upcoming 3-day program is in September, which you all are invited, those of you who want to come and join us. It will be held in Bombay. For those of you who are struggling with the pterygoid implants, zygomatic implants, and now bypass, we have a separate 1-day workshop covering these 3 extensive topics on pterygoid, now bypass, and zygomatic implants. These techniques are useful for both conventional as well as basal implants, which means that by learning the tips and tricks in this lecture, it's a 1-day workshop, morning to evening, quite exhaustive. You will learn the detailed tricks and tips to place a pterygoid implant, now bypass, zygomatic implants, not only with basal but also with conventional implants. Entire thing is given to you, spoon fed to you step by step, so you can quick start or jump start placing these implants in your practice. Or if you're struggling, you will know exactly where you're going wrong and you can start doing this confidently once you reach back. For those of you who want a more detailed orientation, you are welcome to join our residency program, which is totally customized from 3 days to 10 days, depending on your requirements. Let it be conventional implants, basal implants, prosthetics, digital workflow, pterygoid, zygomatic, whatever be it, it is totally one-on-one customizable program for which you need to speak to my team, Risa Enterprise, 9321533493. and they will customize this program for you. For those of you who are still getting stuck up, probably after doing the reading, going through webinars, everything, we also have the one-on-one chair side assistance, the details of which again you will get from the number which I've just put up, 93215-33493. They will be able to give you all the details related to how to get a chair side assistance. It is only for our premium doctors, and they will give you the details regarding this also. So this is the entire way where not only you can get free knowledge, get in-depth knowledge, but also if you want to go deeper, the complete hand holding will be there for you right from stage 1, where you get oriented, start placing implants. Wherever you get stuck up, the WhatsApp groups are there. Still, if you want deeper knowledge, the residency program is there. And still, if you want further help, then the chair side support at your clinic is there. I hope those of you are starting new have now got the complete roadmap of how to get into this. Great. Right? So let me now just go back to my presentation and share with you the exact technique of how to do the intraoral welding. Are you guys ready? Just let me know in the comment box. So Dr. Bhumika Shah, if you're interested in one-day hands-on, or whoever is interested, the number is there, 93215-33493. Just speak to them, DM them, and they will help you out. So how many of you are ready for the pre-recorded live video of how exactly you should be welding in the patient's mouth? Now the trick in intraoral welding, the trick, my friends, in intraoral welding is to not weld. What I mean by this is, lot of us doctors, they'll take the plier in the hand, they'll put the wire somewhere and they will start clamping on it. As a clinician, your role is to control the wire, not the plier. The welding is done with your chairside assistant, your team member. Your job is to hold the wire in the correct position so that when your assistant, the person who is helping you, clamps it, the wire comes in correct position. So the trick in welding is the clinician not welding. How many of you had a bulb on moment when you heard this? Just let me know bulb on, BO in the comment box. And I'll be ready to share the video with all of you. The trick in intraoral welding is the clinician not welding. Okay, let me show you with the video so it will become crystal clear for all of you. So if you see here, there is no need for extensive adaptation. That is the beauty of when you buy the good quality wire. Automatically, as you start welding, the wire will start adapting around the implant. So you don't have to do extensive wire bending. So I heard a lot of WhatsApp comments where doctors are saying which plier to buy, how to do the pre-operative, molding and all those things. It's just not needed. You just start with a good quality wire, and the clinician, okay, somewhere you want to make a minor adaptation, that's fine, but you don't have to sit and give it like a arch form as if you're giving an ortho exam. And now the clinician will hold the wire in the correct position as predetermined, and your chairside assistant is going to do the intraoral welding for you. A lot of us thought that we bought the welder, we are supposed to do the welding. No, you control the wire and your chairside assistant is going to do the welding. And now just see how the quality of welding improves the next time you do it. Okay. So this is, if you see the blue gloves, so purposely for the video, the clinician is wearing the blue gloves. The assistant is wearing the white gloves. So you can identify which hands are doing what work. Along with that, if you need, there is one more hand giving you the air water suctioning. So you may need up to 6 hands to do a good job. If you're skilled enough, you can manage with 4. Otherwise, this will be a 6-handed dentistry. And now you see how the wire is nicely held by the clinician, and the assistant is the one who is doing the intraoral welding. Okay, just see one more time. And absolutely, the patient is not feeling anything. Patient is under anesthesia. Absolutely, because of the adaptation, there is no spark. It's hardly a 7 to 8 minute job to do a full arch case. And you see how beautifully, if your wire quality is good, how beautifully it starts adapting around it. See, there's no spark at all. Just have a look. 0.2 of a second. The patient doesn't even come to know whether any procedure is done in the mouth. That's it, done. Okay. See this. Okay. You will feel a small jerk in your hand and done. That's it. So just go sequentially from one side of the arch to the other side, getting the wire, whatever the extra wire is there, you just have to cut it off with a metal cutting bar. Some doctors prefer some plier. That's okay. That's personal preference. But I like a metal cutting bar with which I can go wherever I want in the mouth and have a nice cut wherever I want. Okay. So this is the welding in the distal part. You see the wire is already adapted. 6 hands. You can see the white gloves, which is the dental assistant doing the welding, and the clinician holding the wire. I hope this is super clear to all. Just type SC in the comment box. Exactly today, it is crystal clear for all of you how to do the intraoral welding. Great, great, great. So I am very happy to know that now all of you are clear. Now just I want to know, before I go and tell you more tricks regarding this, I want to know how many of you already have the intraoral welder. So if you have the intraoral welder, is there a way you can create a poll? Dr. Chaitali, just check. People who have the welder, people who don't, who are planning to buy the welder, and people who are not sure. If you can just create a quick poll, I want all of you to let me know. Those of you who are planning, I hope you have seen today's scheme. It's a one-time scheme. So let me, how many of you are aware of this scheme and want some help to decide, the commercial aspect? Just let me know. We can quickly discuss it also before we move ahead. And how many of you have Trisa welder? Just put up in the comment box if you have Trisa welder, if you have used it. And if you have a positive experience about it, you feel free to share in the comment box, please. Dr. Manu is having, Dr. Manjusha is having, Dr. Chaitra is planning. Great. How many of you have used the Trisa welder and have some kind of a positive experience? Just let me know. Dr. Gaurav, thank you. You like the welder. Thank you. Are you aware that technically the welder earns for itself? Let me tell you how. So when you put an intraoral welding wire, you need to create a denture prosthesis which costs 3 to 4,000 rupees. Okay, let me just explain you how actually the wire makes the work not only easy but is commercially recommended. So why the intraoral welder is technically free for you in 10 cases? Is free for you in 10 cases. Let me explain you the commercial behind it. I hope my screen is visible to all. Is my screen visible to all? why the intraoral welder is technically free for all in 10 cases. So when you place an intraoral wire and you create a denture prosthesis, the cost of denture prosthesis is 3,000 to 5,000 rupees for the denture prosthesis. Full upper and lower jaw both. However, when you create a hybrid, that is metal to acrylic prosthesis, you need to be meticulous in the fitting of the metal bar. There should not be any rocking, and you should be perfect regarding your occlusion so that you get the best output, and the cost to you will be around 23,000 to 25,000 rupees depending which lab you are using. Which means that for every case you are saving close to 20,000 rupees. Every time you use a welder, you are saving 20,000 rupees per arch. Now let's say if you are having a welder which has cost you 1,40,000 rupees, in 7 cases you're done. The welder is free for you. How many of you find this a bulb-on movement where you would have constantly done full mount cases, created hybrid prosthesis, but not thought about purchasing a welder simply because you find it expensive? And now by understanding this logic, if you have at one or even two full mouth cases in a month, your welder is free in 4 to 5 months technically. And this is not it. I'm still coming to the scheme where it will become even more economical for you. How many of you are now ready for the scheme as well? Just let me know ready in the comment box. Thank you, Dr. Chetan, for appreciating Trisa Welder. Thank you, Dr. Manjusha. Thank you. So Dr. Sandeep is planning. Okay, great, great. So a lot of you are planning and you should literally jump up on this offer. Now, let me tell you whether you like to hear this or no, but all our electrical appliances, dental related, medical electric appliances are going to become expensive from 22nd of July. We all know there is a budget upcoming, and you can Google this, that all the medical electronic devices, there will be a change in GST. The moment there's a change in GST, you will see a 5 to 8% change in the pricing, and not all the vendors will be taking the prices on their own. Some of it is already passed to the customers, which means that if you buy a 1 lakh equipment, which goes up by 6 to 7%, you are looking at a 7 to 8,000 rupees price hike after 22nd of July. And you can Google this, that all the medical electronic devices, there is going to be a price hike after the budget. As far as this scheme is concerned, the current price of the welder is 1,40,000 rupees, inclusive of the GST, of which 1.25 lakhs is the cost of the welder and 15,000 is the GST, plus you pay some shipping charges, whatever be your location. However, those of you who are booking the welder today, immediately after the inner circle, exclusively for our inner circle members, only for today, on booking the welder, those of you who are on the edge, you get BCS and QS implants, 10 implants, which are worth 25,000 rupees, which means that this 1,25,000 rupees, straight away 25,000 rupees worth of material bought. So technically your implant has become 1 lakh rupees. Never ever, I can promise you, you will get a great quality welder like a Trisa welder at this kind of price. This is like a take it or leave it offer. Especially for our inner circle members, it's a one-time thing. Trust me, you will bless me for the rest of your life if you have got this kind of a deal, because never you can imagine getting a welder otherwise in 1 lakh rupees. But here, by paying 1,40,000 rupees, you are getting implants worth 25,000 rupees. GST and all, I cannot avoid it. That's government taxes. That's not coming in my pocket also. But you are straight away getting a benefit of 25,000 rupees. And that's how with all the commercial aspects discussed, this 1 lakh rupees you will recover in less than 4 or 5 full mouth cases or 10 arches. And I think this welder will be free for the rest of the life working for you. Yes, by default, we give titanium rods along with the welder. So you need not worry. So every doctor will get a few titanium rods along with the welder. So that goes by default. But this offer is exclusively only for today. So please don't come back to us asking for this offer again. It is only for the members from Inner Circle who are attending this webinar today. And this offer is limited only for today. So those of you who are interested, you need to book on 93215 33493. This is the number for you. If all the money arrangement is not made, you can just speak to them, make some booking initial amount, and then lock the scheme. And then later on, depending upon how things work out, you can finish off your deal. Regarding the servicing and any kind of maintenance required for the welder, the Trisa Enterprise office is in Bombay, and we have another office in Delhi, which can support you for any kind of maintenance which is required. Okay, so my staff is just putting the welder details in our chat box. You can go through it, but this scheme is only for today, where effectively the welder is becoming just 1 lakh rupees for you all. I just explained to you how it is happening. Great. Now let us just start. The other aspects of intraoral welding. Now, how many of you are aware where to weld? Means what I'm asking is whether you will weld cervically or incisally, whether you will weld lingually or buccally, where to weld. How many of you are aware where to weld? Yeah, offer on books and all, you can just speak to Trisa Enterprise staff. And for all Inner Circle members, there are always the offers on all the products. So, but you can speak to it for it on Trisa Enterprise number, and they will help you out. So how many of you are aware of where to weld? Cervically, incisally, labially, lingually, where to weld? Now by default, you should always weld as cervically as possible, never ever incisally. If you weld too incisally, it will be very difficult for you to capture a good impression. Your prosthesis will become too bulky, and sometimes when you mill your abutments, the wire will also get cut off. So always you should weld as cervically as possible. Now whether to weld buccally or lingually depends on your case. So let's say you have a case like this, a massive class 3, you can see the maxilla is deficient and the mandible is prognathic. In this particular case, I have done the intraoral welding cervically and labially to get further a better lip support as what you are seeing in this case. Okay. However, in most cases, generally, you will see that the intraoral welding is required lingually or palatally. And once this is done, you need to make a good impression. Now, how many of you are struggling while making an impression with the intraoral welding? Just put me in the comment box if you are struggling to make a good impression and you want to know the tip in making a good impression after intraoral welding. Now the tip to make a good impression after intraoral welding is to block the undercut with some form of wax or composite. So whenever you have this kind of situation where there is an undercut developed, you block that undercut with some kind of a composite. And then whether you scan or make an impression, you will always get a wonderful impression like the what I'm showing you right now over here. Can you appreciate the beauty of this impression where you can nicely see all the abutments, the wire, and you can even see the scanning after your intraoral welding. Okay, so I hope all of you enjoyed this super tip regarding the welding, and all the aspects related to welding have got clear with you all. Dr. Chaitra, always we use alginate because there will be undercuts in the impression. So you always use alginate. Now, before I take up questions related to intraoral welding and share my last tip of the day, I want all of you to quickly put up in your WhatsApp group, whichever group your inner circle 1, 2 or premium, your 3 key learnings for today, like how we do all the time. So it's just a 30-second break for all of you before I share the tip and trick, the final tip and trick related to intraoral welding, for which you need to hold back for some time. Take up the queries which have been put up, some of them very important. But before I do that, I want all of you to put up in the WhatsApp group, whichever you belong to, 1, 2 or premium, your 3 key learnings. So I'm just giving you a 30-second break. And then we start with the last and the most important part of this session. So I'm just waiting to read your key learnings, what all you people have grasped. I hope, like always, this session you have enjoyed. So Dr. Chaitra Venkatej is writing indications you have learned, adapt the wire. Yes, perfect. Dr. Bhumika taking welding impression with alginate. Clinician holds. Correct. Perfect, Dr. Bhumika. Amazing. Dr. Meena can change bite if needed. Perfect. So it's amazing how a lot of you don't realize that the welder can actually help you make changes in the bite later on. That's really amazing. Dr. Aman, 1.5 mm titanium wire needed, cervical, no gap alginate, weld lingually and cervically. Dr. Bhumika, great. Dr. Moshin is writing 1.5 mm used in full mouth cases, 2 mm in segmental. Perfect. Perfect. I'm very glad all of you have almost summarized all the points, absorbed it. If there are any queries, if you can put up in the chat box, Zoom chat box, I'll be happy to take up any queries now. I think everything is almost covered with our lecture, but still if there is any queries or something you are not clear about, just feel free to put up in the comment box. Super. Maruti Dental, super. Welded cervical. Dr. Sunil, 2 mm for segment. Perfect. Dr. Manjusha, amazing. Labially adapting in class 3 cases. Dr. Shrikant, perfect. Amazing, amazing. So nice to hear all of you have been listening carefully and absorbing all the points is really amazing. If there are any queries. Dr. Rajkumar is asking, any implant can be welded? Yes, you can weld conventional as well as basal. So for conventional, you'll have to connect your abutment on top of your implant, and you can definitely weld the hollow abutments also. Here, the quality of welding and the welder will be very important, because I've seen some cheap welders. The moment you try to clamp a hollow abutment, the abutment squeezes, and then your screw access will get locked forever. So that's a very risky situation. So please buy the standardize good intraoral welders, and you will not have this kind of issues. Thank you for asking this. Very nice question. Irrigant required? Yeah. Technically, the water supply is not helping in the process of welding. But when you put the water, the cooling effect, which I explained, happens very nice. Also, if there is any minor burning fume-like situation, the patient doesn't realize, because the water kind of diffuses the situation very fast. So that's why we always recommend using a air coolant spray, water spray along with your welding. Dr. Shubhas is asking, should we remove the wire after 6 months? Yes. This is the most amazing question a lot of you people ask and want to know. How many of you know whether we should remove the wire? In fact, that was my last tip which I was going to share, whether we are going to remove the wire, not remove the wire, and how to make a decision. Yeah, for pacemaker patients, Dr. Adil, you should not use an intraoral welder. Dr. Chaitra, yeah, the welder comes with a 1 year, Trisa welder comes with a 1 year warranty. Dr. Yogesh, if upper arch, if labial wire is placed along with lingual, you can do that. So what Dr. Yogesh is asking, if you put a labial as well as lingual wire, enforcement will be amazing, but your impression making and prosthetic will become very difficult. But you can do it. If you are very skilled, you can manage it. But otherwise, technically, it will become very difficult for you to, not difficult to do the welding, but too difficult to do the prosthetic part. Dr. Sajid is asking, sometimes if we do welding at neck, mostly wire slips. So what if the wire is slipping? That means the bone is interfering. You need to take the position of your wire a bit more incisally, and you will see that the slipping doesn't happen. Sometimes what happens is you're trying to weld the wire too deep cervically, and then your probe cannot sit nicely on the wire, and that's why it slips. Dr. Srikanth, so if you have blocked the undercuts during the impression making, you don't need to reblock them. And if you have not blocked it, and if there are undercuts, and if your prosthesis, a lot of times it has clicking. I have even done patients where the prosthesis just clicks, there is no cement. Or if I want to use a temporary cement, I use any kind of temporary cement. And then later on, obviously, we are removing the prosthesis, and you can clean up all these things. Dr. Chaitra, I don't think there will be any kind of shock sensation. But if you feel that there is any, just get the earthing of your clinic check. If there is not sufficient earthing, still I don't feel it should be a problem. It will be more like a pain sensation. Maybe you have not anesthetized the patient very nicely before starting the intraoral welding. Dr. Praja is asking, when we combine with two-piece implant. Now, regarding two-piece implant, the welder can be used not only with the abutments cervically. Okay, you can do it cervically, Dr. Praja, but also you can use for impression making. So let's say you have done a conventional implant, 6 or 8 implants. You place your impression, open tray impression post. Now, a lot of time gets wasted in tying a floss and putting pattern resin. Instead, just take a welder, put the wire and start tuck, 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 tuck. In 2 or 3 minutes, all your implant prosthetic impression post will get sufficient stiffness. You just have to make an impression. How many of you found this tip amazing? For taking impression for two-stage conventional implants, you can use an intraoral welder. Let me repeat it. The use of an intraoral welder for two-stage implantology impression making. So let's say I put 6 or 8 implants, I connect the impression post. Now, instead of putting pattern resin and doing all that thing, just take a wire, start welding it, tuck, 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 1 or 2 minutes. All your impression post will get connected beautifully, and you can make an impression and really save a lot of time. So this is another space where an intraoral welder can help you in accurate impression making. There's no way your impression posts will move, and it just works wonderfully. Dr. Kalpana is asking, milling of abutment should be done before or after welding? After welding. Dr. Sajid, while we hold probe on its implant specifically, is it if it is basal and long implant, I feel like implant is moving. Yes, Dr. Sajid, excellent observation. So what Dr. Sajid is saying, that when you try to clamp the implant, you feel the implant is moving, and this is the inherent nature of the implants. They are isoelastic in nature. So definitely you may feel that there is a minor mobility of implant, but that is only before the welding. The moment you weld it, they will become rock solid, and this is because of the inherent isoelasticity of the implant. Great. How many of you thoroughly enjoyed this session with the deep insights on intraoral welding? Just let me know in the comment box. Your feedback, reviews are always welcome. They keep me motivated and charged to do such more sessions for all of you. You can please put it up in the inner circle WhatsApp groups. I will be really obliged if you can share today's feedback, whatever you have learned, and it will keep me charged up for our next session. So thank you so much for joining me today. I hope you had a good time. And for any queries, you can message on our numbers 9321533493. The premium group, if anyone wants to join, you let me know. Until next time, thank you very much.